our young doctor was regarding the national exit test. So what will be the national exit test? We want to conduct a test covering your clinical subject and related other material from previous subject which you have studied in reasonable manner, which should cover most of the things what you study during your MBBS. The attempt will be to test what you know, not to test what you don't know. It is going to be a comprehensive computer-based examination based on high-quality multiple choice question. When I am saying high quality doesn't mean difficult. High quality means it is going to be uniform for everybody. Predictability outcome for an average student is going to be uniform across all medical colleges. That is what it means, high quality. There is no variation from place to place. This will, of course, this will ensure objectivity and nationwide delivery at the same time, and it is going to be in a robust manner. And they will, test both. It's in a small part we call analytical approach as well as comprehension.
Next.
And in comprehension, you must have seen what is comprehension. You should be able to see what is being conveyed and to be very precise in a way to decode the stem of the question. As I told you earlier, that will tell you basically what is the likely answer out of the 4 choices which you are going to see. We want to discourage the mucking up of things, the rote learning. 5 causes of this thing, what are causes of constipation, what are complications of narcotic analgesic. You should know narcotic analgesics can cause these things. It acts at cerebral cortex. The cause effect of antihistamine is this, and brain stem effect is this. So it's going to be the complications also, depending on the dose at what level it is going to affect. So that kind of understanding, when you study, you develop, everything is going to be very easy for you. Now the problem solving and analytical problem solving, they can give a case scenario, a set of investigation. Can you ask the diagnosis or give diagnosis? Few laboratory tests and can ask you what next investigation you will ask for this patient. You might say, I'll ask for CT scan or something, or whatever. That it is going to be simple, very logical approach. Whatever you have been taught in your wards, most of the things will be from your clinical learning, practical learning. Then, of course, recall type. So, and what I am saying the next is level of knowledge. Basically, this is because when we are preparing merit for post-graduation, then there should be some grading. For passing MBBS is all right. Everybody performs at what level, there is no issue. We have a doctor who should have minimum competence expected out of an Indian graduate who is going to treat our citizens. But when we prepare merit, then we have to have questions of different difficulty index. So must know are the questions which will be forming the main component of a doctor should know when he is going to be a doctor in community. So means you must know as a doctor these information. So that kind of question that will form out 60%. This will give you a fairly good chance of passing the exam if you know this one. Nice to know, slightly difficult, where you need to have analytical approach. You have to think little, in a direction. As a clinician, these are the things what I should do. There can be little confusion created. So in this one, STEM can create little confusion, or the choices also can be little, the difference between 4 choices may not be very obvious. So that also can increase this. That will be about 30%. May know. To differentiate in top 10-15% of student questions are going to be little difficult. That can be based on the recall phenomena. or asking for some unusual situation, which we routinely don't encounter. The type 30% and 10% are basically to differentiate that thing in preparing the merit. Why this? Not because of anything that we want to create problem, but anyway, when somebody wants to go for higher study, he should prove his worth as compared to his other colleagues so that he gets subject of his choice. Many of you might prefer surgery as first choice, but there may be many people who may not like to become surgeon. Similarly, pediatric medicine or medicine, whatever subject. So to differentiate that only the better candidate gets the subject of his choice, that is why these two categories will be there. But to prove yourself in the field when you are treating patient in the community or in a hospital or in a medical college also, you have to be better to treat your patients better than an average doctor. So that is also another objective. So when you study, you can keep these things in mind. Next please. Can you change? Yeah. These are the subjects. Three major: surgery, medicine and allied, surgery and allied, and obstetrics gynecology. Now, many must be thinking, what are these allied subjects? Medicine and related, questions from cardiology, respiratory medicine, gastroenterology, as anyway you are reading. Plus, allied, maybe from your first and second prof, related subject, forensic medicine, community medicine, subject, topic as related to medicine, may be asked. Suppose they ask some viral pneumonia. What do you understand by? Is it a particular type pneumonia? Is it a nosocomial occurring in hospital setting? Or it's a community acquired pneumonia? That kind of questions may be asked. So it is going to be simple. Secondly, in FMT or anything, suppose somebody sustained a blood injury on the right side of the flank. Then and the patient comes initially with pain abdomen, but gradually he starts developing hypotension. What can be the type of injury? Now, if you have read and you know that a right side liver is there, there can be injury to liver. Lower down flank on the lateral side, kidney is there, there can be injury to kidney. If somebody has hit full stomach, there can be injury to stomach. You should know that. So that is what I mean by allied subject, related, applied subject, as it applies to that. So community medicine, and you know that many clinical situations, they are heavily dependent on factors given in pathology, microbiology, and other things. But these things are going to be limited. We have kept 10%, maybe a little more, or as per your understanding of allied. But we will be keeping around that part. Number will be according to that. See the screen? Yeah, it has come back. So don't worry about that. Allied subjects also in surgery, like orthopedics can be there. Suppose somebody sustained a head injury, a blood injury, he had a fall, blood injury was there, patient walked in normally, nothing happened. But after a gap of few hours, patient went into a sudden drowsiness development, went into coma. What kind of findings you are likely to find? It is going to be cerebral hematoma, concussion injury, or what? A hypertensive went through severe stress in the family. He complained of headache and suddenly he started vomiting. Now, what can be the reason? These are the applied aspects. So that you should know, and that much of neurology, neurosurgery, everything is taught to you. These are going to be very simple questions which every MBBS student studies. So I wanted to remove your allied subjects apprehension. I hope I have made it amply clear, and your faculty members will further clear it out. And when you will start reading, there is no problem going to pediatrics. ENT and ophthalmology. 60 questions each. And in these also, other allied subject can be there. Somebody, two kids were fighting, somebody got boxed on the eye. The eyeballs appear a little smaller. Vision is normal. What can be the thing? Can it be a Govt fracture? Or it can be just a retinal detachment in adult patient. So these things are simple thing. Bow and arrow were being used by kids. Somebody kid didn't either something injured him. What is injury? Should he go to the ophthalmologist immediately? What are the types of injury? Similar questions are going to be asked. It is not going to be anything out of your course in lecture theatre and in board. So, next slide, please. See, we have been very considerate, I'll tell you. 120 questions and 3 hours. Those who have taken USMLE, they know questions are anywhere between 160 to 210 in 3 hours. But we don't want to create that kind of situation for you. Our idea is that you should feel comfortable. So we have kept only 120 questions for 3 hours. So practically you'll be getting 1.5 minutes. This is good enough. Average time. And that will be enough for you. Then 2 hours rest. So you go out, you have tea, coffee or light meal, come back. In the afternoon, we have kept a smaller subject. And in pediatrics also, many things will come from medicine also. So you don't have to worry. And time is 1.5 hours. We are not keeping it every day. We are giving you a rest day. And obstetrics gynae, we have kept 3 hours, which I think is more than enough for you. So these are going to be the papers. You will have ample time to answer all those questions. Next, let us go to the next. I'll talk very briefly about step 2. Step 2, what has been seen that our best of our doctors who studied very well during 4.5 years course and who were selected in very good institute also, they cracked even AIMS and PGI exam. They were poor when they were doing attending patient bedside. And the single most factor was they were not actively participating in teaching program or training during their internship. Internship forms the base on which rest of our career will depend. Whatever we learn during our internship, it stays with us forever. Whatever procedure you have attempted during internship, when you join your house job, first year PG, you will ahead of others and this will give you such a moral boosting, positivity in your thought process that rest of 3 years for you during your post graduation will be enjoyable. Otherwise, you will always be tense. Internship, if you do well, the exam we are kept in such a way that it is not going to give you any merit that you score so much of it, only pass or fail. You have learned enough during internship or you have not learned enough during internship to be an independent doctor to look after citizens of our country. That is the whole objective. But achievements are multifold. If you do well in all your competitive exam abroad or here, you will do better if you have done your internship well. You can carry a handbook during your internship, pocket book of surgery or medicine. There are books available, surgery on round or medicine on round. You carry that, whatever you study bedside, you read even once. Any type of patient, for rest of the life, you don't have to read that. It is always going to stay with you. What you have to do rest of the life? The advances in knowledge, you have to keep yourself updated. So we are concerned that all interns should be very sincere for 1 year when they are going to bedside and should never miss any internship posting. Never, that is going to make you an excellent doctor and specialist also later on. So that is why this exam will be conducted after 1 year. When you are going to complete this exam, as each exam will be of actual case or costly, that is objective structured clinical examination. If you don't understand this term, don't bother now. During internship, you will know, your faculty, your teachers will tell you. Simulations, in your simulation lab, they can take you and they can ask you, or they can ask you to intubate a dummy or whatever. That will depend on the university exam which is going to be conducted. But in this also, we will try to make that for all interns all over the country, the assessment is going to be uniform and same. So it is going to be only pass or fail. Once you pass step 1 and practical exam which is going to be conducted by respective universities. We are not encouraging on that. You will be eligible to get temporary registration to start internship. It will be done automatically. Once you have finished internship and you have passed this, you are eligible to participate in PG entrance exam. You are eligible to get permanent registration and practice as an independent graduate of India. So that is why this is important. What are the subjects? Medicine and allied subject. Rest of the things are same except orthopedics and PMR, physical medicine and rehabilitation. Because when you go as a doctor in periphery, as a graduate doctor, then sometimes some child mother will say, I don't know why he's crying, I just lifted him from one place and put on there. Without realizing that she lifted by holding one arm. This might have dislocated his shoulder or created sprain in the elbow or anything. So you as a doctor should know during internship. So your ortho training also you should be doing very carefully. You will be seeing a lot of accident and trauma cases. So you should know how to stabilize organs which are having obvious trauma or which are likely to have trauma. They should be stabilized. So splitting has to be done. Any case of trauma, we all know the neck has to be stabilized. So this you should all know. These kind of things will be asked in orthopedics and PMR. How to help in for minor exercise to a geriatric patient who comes to you. So all these things will be assessed during your internship. It is going to be fun if you have worked during your exam. I don't think if you have been attending all your internship posting, anybody should fail after 1 year. I am so much sure if you are regular. Only those who have missed, they will have problem. Then only God can help such, because during rest of the life, what are they going to do? Patients will avoid coming to their clinic. So better be sincere during your internship also. The time schedule and modalities of next 2 exam will be decided and will be informed you well in time. So there's not an issue, and this exam is to be conducted before the counseling for PG starts. So this exam, step 1, suppose you are finishing in February. I'm just giving an example. Don't take it as it is. Then probably we might start January. For extent batch which are going to complete course on 31st December, step 1 will be conducted in November. Those who are going to complete on 30th June will be conducted in May and should be over by 2nd or 3rd week. Practical exams will be conducted in initial 2 weeks of the next month, that is June and December. So the result is out by end of 3rd week, definitely. So that participation in PG exam can be there without any problem. Similarly, the internship also, in the last month of internship, step 2 exam will be taken. As of now, conduction of mock test, or you can call it practice test also. We as of now have decided 28th of July. Registration will start, that you will know that should be 28th June, the advertise The notice was supposed to come today, so let us see what AIMS has been done. AIMS has done. And this time we are permitting only final MBBS student because this exam is in with the idea of removing anxiety from the minds of final MBBS student exam. And this I had planned when NMC came to existence. And those who know, who are communicating initially, they will remember I had said that this exam is not to make your life tough, it is going to make your life comfortable. Just imagine with one exam, you are MBBS doctor, you are qualified to start your internship. Finishing internship, you will be an independent doctor. Based on the same exam, you can take PG also. You don't have to take NEET PG every year. Be there with lot of uncertainty. I'll get my choice or not. So that is why we are doing this. So that with the same exam, or if you are not happy with your score, you can take the next exam again. But after completing step 2 exam. One thing I want to make clear that the score which will be counted for PG will be the score of your one complete cycle. Many students must be thinking now, okay, in first I will just clear major subject, try to score better in those, and the rest subject I will take in second attempt to get a good merit, to get good PG. They are mistaken. In one cycle, whatever be the total number of total marks, that mark will be the marks to be counted for preparing ranking for PG allocation. And other things will be made clear in the Act, which is Gazette notification, which is going to come in the near future. So I hope I have made myself amply clear, and I wish you all a very good luck for your final MBBS step 1.